Department of Education Deputy Commissioner Heather Mueller. After that, we will open it up for questions from reporters on the line. With that, I'll now turn it over to Chris Erzman.
Thank you, Mike. I want to start out our call today by saying that our thoughts are with President Trump, the First Lady, and others as they deal with COVID-19 infections. We wish them a speedy and full recovery. You may have seen the statement we sent out earlier today in which we explained that the public health response here is the same as it would be for any other situation involving positive cases and close contacts. While we work with other public health departments collaboratively, our department does not get involved in the contact tracing for President Trump and his staff or for others who are not Minnesota residents. Our focus is on contact tracing and case investigations for Minnesota residents. There is a potential risk that transmission occurred at the Duluth rally and other events associated with President Trump's visits. Community transmission of COVID-19 was high in St. Louis County prior to this week's rally, and people attending the rally may have been infectious without realizing it. The focus now must be on limiting the ripple effects and slowing any secondary transmission that might result. We know that many who attended events may have questions about what to do next. Our guidance is as follows. Anyone who attended events associated with the president's visit and who now have symptoms should get tested. People should consider getting tested even if they don't have symptoms because some people may not develop or recognize symptoms, and people can spread the virus even without displaying symptoms. People should get tested within 5 to 7 days of the event. If they test negative, they should get tested again around 12 days after the event. People should get tested in their home communities and seek testing from their healthcare provider when possible. Anyone who is a direct contact of President Trump or known COVID-19 cases needs to quarantine and should get tested. It is important to understand that quarantine for 14 days is necessary regardless of test results. Anyone who attended any large group gathering, especially one with limited social distancing and/or masking, should be alert to potential symptoms of COVID-19 infection and limit social interactions for 14 days. This is true even if they feel no symptoms of illness. Fortunately, there are a number of locations around the state to get a COVID-19 test. Any Minnesotan wishing to be tested in the Duluth area can get a test at the testing site set up at the Duluth Entertainment Convention Center, or DECC. There will be 7 community testing sites around the state next week. You can get more information on our MDH website. And now let me turn to the global and national update. Today, as of this morning, we were above 34.3 million cases and 1,002,000 deaths. In the United States this morning, we had more than 7.2 million cases and 207,000 deaths. We added 1,184 cases yesterday for a new total of 101,366 cases in Minnesota. The median age of cases is 35 years old. The new total of deaths in Minnesota is 2,059, up 10 from yesterday. 7 of these deaths occurred in residents of long-term care facilities, 3 each in Hennepin and St. Louis counties, and 1 each in Martin, Murray, Pipestone, and Washington counties. The total includes 2 in their 90s, 5 in their 80s, 2 in their 70s, and 1 in their 60s. There have been a total of 7,793 patients hospitalized and 2,156 individuals received intensive care. Our focus on the call today is our schools and our school data. Starting today, we are including additional school-related COVID-19 data in the weekly report. The data specific to pre-K through 12 schools focuses on cases associated with school buildings where the student or staff member was in a school building while infectious. This does not include individuals who are associated with the school but were not present on site or were on a bus or transportation vehicle while infectious but never went into the building. For example, a student who is distance learning and becomes ill with COVID but has not entered a school building during their infectious period would not be included in these data. The goal of this information is to show the impact of COVID-19 on all Minnesota schools, including public and non-public schools. The new data includes lab-confirmed cases of COVID-19 associated with school staff and students who worked or attended school at a Minnesota pre-K through 12 school building while they were infectious or able to spread COVID-19. The cumulative number of K through 12 school buildings reporting cases, and the names of pre-K through 12 schools who have 5 or more confirmed cases within a 2-week period. Please note that schools will be removed from this list after 28 days with no new laboratory confirmed cases. It is important to highlight that these cases do not mean that people got COVID from being at school. It also does not mean that these cases definitively resulted in transmission or other people getting COVID while at school. It simply means that they had a laboratory confirmed COVID-19 test and were infectious while in a school building. This data shows that since August 1st, there have been 864 laboratory confirmed cases of COVID in the pre-K through 12 school buildings, 448 of which were among school staff and 416 of which are among students. 509 pre-K through 12 school buildings in the state have reported at least one positive case since August 1st. 326 facilities have reported confirmed cases within the most recent 2-week period. 242 of those facilities have had only one case. 77 of those facilities have had between 2 and 4 cases, and 7 of those facilities have had 5 or more cases. To see the list of 7 identified schools, please visit our MDH website, specifically the situation update for COVID-19. And with that, I will turn it over to Deputy Commissioner Heather Mueller.
Thank you, Chris. I appreciate the work that everyone has put into making the information available to Minnesotans and our continued partnership with the Minnesota Department of Health. As Chris said, my name is Heather Mueller, and I'm the Deputy Commissioner with the Minnesota Department of Education. And this is an important part of our effort to be transparent with the public about the prevalence of COVID-19 in our school buildings across the state and to provide an accurate picture of how the virus is impacting our school communities. We know that some schools are already providing this data at the local level with dashboards or dedicated web pages, and we appreciate their commitment to their community and to their schools and to keep them informed. This data reinforces the importance of the measures our schools have implemented in order to keep our students and staff healthy and safe, and I thank our educators, school leaders for their tireless work, and it takes all of us to make this happen. The data also serves as a reminder of just how critical it is to continue wearing masks, washing hands, and practicing social distancing. Thank you to our students for keeping up on this and to the adults for setting a positive example for our students. Thank you again to those who have worked to make this data available. And with that, I will pass it back to Mike.
Thank you, Deputy Commissioner. As we open it up for questions, we'll ask that reporters limit themselves to one primary and one follow-up, since we have a number of reporters on the line today. With that, operator, we're ready to take questions.
As a reminder, to ask a question, just press *1 on your telephone keypad. To withdraw your question, just press the # key. Again, that's *1 to ask a question. Your first question comes from the line of Jeremy Olson from the Star Tribune.
Hi, Chris. Earlier in the week, Assistant Commissioner Huff had said that, I believe it said that Health Department would be monitoring the President's campaign events for compliance with COVID safety recommendations. Did you do so? And what is the Health Department's assessment of the risk level at that event, particularly in Duluth, perhaps of speakers infecting attendees or crowd members being able to infect one another? What's your assessment of it if you were monitoring it?
Well, I can tell you that the things that that we saw related to that event suggested to us that in fact, it was possible that there could have been transmission occurring at the rally and other events associated with the president's visit. And so that is why we have provided the information that we did to the public on what steps would be necessary should they have been participating in those events, and then based on where they're at in terms of symptoms or not symptoms.
Are you considering any kind of follow-up to that in terms of talking with the people who hosted the event and those that were in charge of making it a safe event, whether it be sanctions or just follow-up information? Are you doing any of that kind of outreach right now, or punishment?
Well, a couple of things. One is we have not gotten any information in terms of, lists of attendees from the events. If we would have access to that information, we would certainly do follow-up on those situations. And then Commissioner Malcolm is not on today's call, and so some of these questions related to sanctions and things are outside of my area of focus. But certainly, we have provided guidance on what it's important to see when people are going to be gathering together. So social distancing, wearing masks, avoiding crowds, all of those important pillars of preventing COVID. And certainly, the governor provided information to event organizers about how to conduct a safe event. But other than that, I can't comment any more on those things. That would be up to the commissioner to do so.
Thank you.
Your next question comes from the line of Elizabeth Schuckman from Minnesota Public Radio.
Hello?
Ms. Elizabeth Schuckman, your line is now open. Your next question comes from the line of Carla Holt from Care 11.
Hi, thanks so much. Appreciate you taking my call. I wanted to follow up on Jeremy's questions regarding those who attended the events. Can you tell us, Chris, you just suggested that there is no record of who might have attended. Is that true also for the private fundraiser that I believe happened at Lake Minnetonka, the Shoreward Estate? And can you confirm whether the RNC chair was in fact among the attendees there?
Carla, thank you for that question. I just want to be clear that we have not received any information about the attendees and have not been shared a list of attendees, so I can't comment on who was not present. Certainly, if we receive that information, we will definitely follow up with individuals and provide them with the same kind of information that we would provide to any Minnesotan who might have potentially been exposed to COVID. Normally, when we have a case of COVID, as part of our case investigation, we speak with the individual and get a sense of their movements and identify their potential contacts and exposures. And obviously, in the case of the President of the United States, we will not be doing that kind of an investigation. He's not a Minnesota resident, so we would be relying on receiving that from other groups.
And I believe, okay, because Ronna McDaniel has been known, or it's been reported that she has tested positive, so it's just conflicting information at this point as to whether she was actually present, but I appreciate what you just said there. So for those who did attend the Duluth rally, and frankly, there was a lot of media who also were there, what do we need to explicitly know? I know that you had those guidelines regarding look for those symptoms within 14 days and that sort of thing, but are you preparing, even in the Twin Cities, recognizing that people came from all over, for a possible uptick now in requested tests?
Yes, so our guidance, obviously, we recognize that people may not have been socially distanced, they may not have been masking, and obviously it was a large group. So if you're someone who attended and you realize that, you weren't masked, you were close to other people and all of those things, then what you want to consider is if you have symptoms, you should get tested, just like we recommend for anyone. But even if you don't have symptoms, you may want to consider getting tested because you may not develop symptoms. We recognize that there are asymptomatic cases of COVID who can still be infectious. And then sometimes for some individuals, symptoms are quite mild. So if you're someone who attended and you want to consider getting tested, we'd recommend that that be done 5 to 7 days after the event. And then if you are negative, then we would recommend that you get tested again at 12 days after the event. And our recommendation is that, yes, you get tested in your home community and with your healthcare provider if possible. And then if you happened, and I suppose if you were in the media, this is probably a potentially more likely scenario, but if you were a direct contact of the president or any known COVID-19 case, then you should be quarantined and tested. And it's important to keep in mind that the quarantine is for 14 days, and you need to be quarantined for that full period regardless of your test results.
All right, thank you, Chris.
Your next question comes from the line of Elizabeth Shackman from Minnesota Public Radio. Your line is now open.
Thanks for taking my question. Do we know yet if opening schools was contributing to the spread of this virus? When I looked at the weekly report today, it seemed like there was a jump in cases in mid-September. Does this show that in-person classes are contributing to the spread?
Well, I'll start and then I'll see if Deputy Commissioner Mueller would like to comment as well. You know, yes, we have seen cases, or it would look like we're seeing a jump in cases in the last few weeks because school started, but keep in mind that prior to that time, there was no ability to link a case that may have had an exposure due to a social event or an athletic event to a school because their school was not in session. So I think we have to look at this kind of in two ways, that yes, there is a potential for transmission in the school setting, but the cases that we're seeing are not necessarily cases that have occurred because of transmission in school. That's not what the data represents. It really simply says that this was someone who was infectious and in the building during their infectious period. So I think we want to be somewhat cautious in how the data are interpreted, because prior to the start of school, if say a young person acquired COVID, their case would not have been tied to a school setting. So I think we just want to be cautious about that. But at this point, I think what's significant is the fact that when we look at the data, the vast majority of facilities or schools have had only one case in their facility. There are only 7 that have had 5 or more cases. And so I think that's very positive. We're not seeing large outbreaks at all that have been associated with the school setting. But I will turn it over to Deputy Commissioner Mueller to comment as well.
Well, thank you, Director Erzman. I appreciate that, and I think I have nothing more to add. You're the expert in that area, and I think it's a really important component to identify that we have not had schools in prior to this, and so the alignment of that may not be appropriate.
Okay, I think my follow-up question to that is, if you can provide data on, in these cases, how many of them, do we know how many of them were contracted or transmitted in schools? And will that be part of the weekly report going forward? And how will we start to answer that question in Minnesota? What's the plan to answer the question as far as, is COVID spreading as a result of in-person classes?
Yes, I mean, we'll continue to look at what we're seeing in terms of the cases. At this point, as I said, we're just a month in, and we thankfully have not seen many schools with more than 5 cases, just 7. I think that will be an important indicator. You can see in the data that we're providing that we're breaking cases down by a single case, 2 to 4 cases, and 5+ cases. And certainly, if we have a situation, in which we start to see a problem area that we're seeing large numbers of cases, or excuse me, large numbers of schools with more than 5 cases, that'll be something that we'll be looking at. But I would say that right now, 72% of the schools have had just a single case. So obviously in that situation, we know that there has been no transmission. So I hope that's helpful.
Your next question comes from the line of Erin Hassan-Dada of WCCO.
Hi, yeah, I'm wondering, you're talking about events associated with the president could also have potential exposures. When we think about Eric Trump being in Becker, I just wondered if you guys have put that county on notice, or if you're going to have to do any extra sort of legwork in the Becker area with that event.
And I'm sorry, you said that who was in Becker, Eric Trump?
Eric Trump was in Becker yesterday, and we don't know if he's tested positive or not, but wondered if you did know, or if you had reason to start putting the Becker area on notice as well, or anyone who attended that rally.
No, we have not. We have not been made aware that he tested positive, and so have not put anyone on notice. I do think, though, just to reiterate our guidance, you know, if you've attended a large group gathering, especially one with limited social distancing or lack of masking, you really should be alert to potential symptoms of COVID-19 and limit your social interactions for 14 days, because certainly, you know, all of these individuals that have been mentioned are high-profile figures, but we know that in addition to the president's visit and things, that we are seeing a great deal of community transmission from COVID across the state. And so anytime you've got people gathering together in large groups like that, it's a time to be aware of the fact that there is a potential for transmission. So at this point, I can say that we have not heard anything about Eric Trump or gotten any information there. But if you were attending a rally where lots of people were together, not socially distanced and not masking, you should be alert to the fact that there may have been a potential for transmission.
Great, and my follow-up is just when we look at, you know, members of, you know, local government here, or, you know, GOP members that were with the president, do you want to talk about the process of contact tracing, kind of those local high-profile people, and how far that could go?
Well, certainly. I mean, I think it's important to recognize that we recognize the fact that this situation has impacted a large number of very, as you said, high-profile individuals, our elected leadership. And so we're looking at it perhaps differently than if it was just you or I. But I think it's important to keep in mind that the biology of how the COVID virus acts, it doesn't care if it's me or the president. The means and routes of transmission and the principles are still the same. And so if should a high-profile Minnesotan, you know, acquire COVID, we would work with them in the same way that we work with anyone else. We would talk to them about their contacts, what events they participated in the 2 days before their symptom onset. We would work with them to get those contacts, and we would do the necessary follow-up. So we obviously our work is consistent for everyone. We have very strong data privacy requirements, but we certainly, if we discovered that someone was positive, we would do the same follow-up for them as we would for anyone else.
Great, thank you.
Your next question comes from the line of Catherine Ricard from Minnesota Public Radio.
Hi, I'm going to ask something unrelated to these questions. We came across an event that's being held at CHS Field tomorrow. that is asking people who attend to assign a waiver as part of their COVID-19 safety plan. And I'm wondering, Chris, like, is this something you're seeing more of? Any thoughts from the health department on these waivers and who they're meant to protect here?
Thank you. I was not aware of that. And I know that I have seen that, you know, at a salon where people have been asked to sign a waiver. I think that a couple of things. That really is a decision that an event or a facility makes with their legal counsel, and so you know, that decision to say we want our participants to have signed a waiver, that's really between them and their legal counsel, so I cannot comment on that. I think, you know, I'll just kind of go back to our overall guidance, and that is that we know that when people are gathering in settings with large groups of people without the potential to social distance, and if people aren't wearing masks and things, that can contribute to spread. Now, I cannot comment on this event. I'm guessing that they will be following the guidance that we've put forth and that people will be masking and all of those things. But certainly, anytime you're in a situation where you're gathering with lots of people, there is a risk for transmission. So I think that it's a decision that they have made with their legal counsel, I'm sure, and they could possibly comment on it. But whatever someone's doing, if you're in a situation where you're gathering with large groups of people, you need to keep in mind, whether or not you're signing a waiver or not, that there is that potential for transmission.
Okay, and just a quick and unrelated follow-up to clarify the advice you put out earlier today about folks who may have attended some of those Trump-related events. When you are advising people to quarantine if they believe they've been exposed, does that apply to everyone else in their household, like kids or spouses who didn't attend?
So for an individual who attended an event, the focus is on them and making sure that they're quarantined. I think where things get challenging is if that person would develop symptoms, then their family members would need to start a quarantine period following that. So it does get to be complicated, but our guidance is for the individuals who were at the event.
Okay, thank you.
Your next question comes from the line of Susanna Lutke of WCCO.
Hi, can you hear me?
Yes.
Okay, great. I'm actually with Politico, but thank you for doing this call. So just two questions. Did the President's administration or anyone with his campaign contact you at all after his diagnosis? So I guess today, and if so, you know, what was that like? And then also, Jill Biden just sent out, or the Biden campaign just sent out a notice that Jill Biden will be traveling to Minnesota tomorrow for some campaign events. And given that her husband was potentially exposed in the debate on Tuesday with the president, just wondering if you've had any conversations or concerns with the campaign about her coming.
Okay, so thank you for those questions. To your first question, did anyone contact us? No, we actually heard about it in the news and when the media started reaching out to us. So no, we have not had any contact from anyone related to that event. And then in terms of Jill Biden, at this point, it would relate back to the situation that I was just asked about someone who was exposed to someone who was exposed to a case. And so in that case, Mrs. Biden, her coming to Minnesota, she's negative, and that shouldn't be a problem. Of course, our guidance about, you know, how best to avoid transmission with group size, masking, social distancing, that all would continue to stand.
Thank you.
Your next question comes from the line of Chris Rogers of Winona Post.
Hi, thanks for putting up the K-12 data. Really appreciate that. I wanted to ask about colleges and universities, if MDH is still planning on posting something similar for them.
Yes, that actually should be up on the web today. It was supposed to go up together. Did it not?
Where can I find it?
It should be in the weekly report. So if you scroll down to the bottom at the web page, it should be on the weekly report.
Okay, thank you.
But I'll tell you this, since you were interested. We've had 97 higher education facilities that have reported cases. In the 1 to 10 range, 58 institutions. In the 11 to 30 range, 11. In the 31 to 99 range, 7. And 1 institution with more than 100 cases. And we just always want to make sure that we're acknowledging that these are cases, just like with the school setting, that have an affiliation with an institute of higher education, but does not necessarily mean that transmission occurred on campus. And then just a couple of other details for you. We have 2,805 cases associated with institutes of higher education. 9 people have been hospitalized, 3 have been in intensive care. So those are our numbers cumulative as of August 1st.
Thank you.
Your next question comes from the line of Erin Golden of Star Tribune.
Hi, I have a question about the K-12 numbers. I wonder if you could explain why the specific names of the schools are limited just to those that have had 5 or more. I think a lot of people are curious about why they can't find out when there's 1 case or 2 cases in a building. And then second part of my question is what, if any, direction or requirements are there for districts or schools about what they report when there's even a single case in their building?
Well, a couple of things. I'll just comment that our guidance to schools has to do with making sure that they are notifying situations where there's an exposure. So just like in any other setting, if you have a case, then who are those individuals who have been exposed, who need to be quarantined? So that's our focus, and we want to make sure that those individuals are notified. And oftentimes, you know, it's like, say in an elementary school, it may be a classroom. But then we also ask that notification, so there would be a special letter or notification that would go to those individuals, but then we also ask that there would be additional notification with the larger school community. And our focus on the 5 cases in a school, and then I'll let Deputy Commissioner Mueller comment too, is just that it's really difficult to say whether or not cases are, as I mentioned earlier, have to do with the large amount of community transmission that we're seeing. And so we wanted to make sure that when we were giving the name of a school, that we were doing so in a situation where it was more likely that there could have been something associated with the school. And that's also the number that other states are using. But Deputy Commissioner Mueller.
Thank you. I think the other thing that's important to note is that our school districts and charter schools are working with their local public health, the Minnesota Department of Health, and our regional support teams, that if there is even 1 case, they are communicating with families that need to know that there is a case. And so just because it is not being reported statewide or on a website, it does not mean that the school community does not have information as it pertains to that.
So just to clarify that, then if there is a single case in a building, then schools are directed to notify every parent, every student, teacher in that building, or what does the broader notification mean, I guess?
Oh, Well, I can say that our guidance to them, first and foremost, is about the individuals who've been exposed. And that is the priority because that's where public health action needs to happen. And then we ask that as a courtesy that they let the broader school community know that there was a case in the facility. And that's just as a courtesy. There's not a public health need for that, particularly, again, as we're in a position where we have so much transmission occurring at the community level.
Thank you.
Operator, we have time for one more question.
Your last question comes from the line of Jeremy Olson from the Star Tribune.
Hi. The fact that there was 3 schools from Martin County just reminded me about the funeral event you had discussed a week or 2 ago. I wonder if you can give an update on that funeral event, and also, did that event cause these school outbreaks, or were they happening at the same time? I'm just wondering what the relationship between that large outbreak event and then the broader community have in common.
Certainly. So I can do further checking today. The last time that I checked, we were at 39 cases associated with that particular funeral event, but I will double check because I think it's been a few days since I got the most recent numbers. And then I think it's important to keep in mind that there's definitely transmission that's been occurring in the community in Martin County, and so that has an impact on the school. So I would say at this point the focus is more on what's happening in the community and what we're seeing in the community for them.
Okay, thank you.
That's all the time we have for today. We invite any reporters with additional questions to reach out to our communications office this afternoon. Have a good day, and we will be back with you again on Monday.
This has been a WDIO News Special Report.